Anxiety disorder in general. Generalized anxiety disorder, GAD, is a chronic state of severe worry and tension, often without provocation. Those with GAD regularly anticipate disaster, often worrying excessively about health, money, family, or work. Simply getting through the day causes anxiety. People suffering from GAD can't get rid of their worries, even though they usually realize that much of their anxiety is unfounded. People suffering from GAD may be unable to relax and frequently have difficulty falling or staying asleep. Physical symptoms include trembling, twitching, muscle tension, headaches, irritability, sweating, hot flashes, and feeling lightheaded or out of breath. Many people with GAD are easily startled. They tend to feel tired, have trouble concentrating, and may suffer from depression. GAD symptoms include nausea, frequent trips to the bathroom, and a lump in the throat. When their anxiety level is modest, people with GAD can function socially and hold down a job, but they may have difficulties carrying out the simplest of everyday activities if their anxiety is excessive. GAD affects roughly 6.8 million American adults. Women are twice as likely as men to be afflicted. The disorder can appear at any stage of life, but it most commonly appears between childhood and middle age. The diagnosis is most common in middle age and gradually declines in later life. Other anxiety disorders, depression, or drug use disorders often accompany GAD. GAD is frequently treated with medication or cognitive behavioral therapy, but co-occurring problems must also be addressed with the appropriate methods. The DSM-5 defines GAD as 6 months or more of chronic, exaggerated worry and tension that is unfounded or far worse than the normal anxiety that most people experience. People with this condition frequently encounter symptoms, including inability to stop worrying excessively, having trouble falling or staying asleep, irritability, easily startled or becoming scared, difficulty concentrating or going blank. The following are some common physical symptoms: headaches and exhaustion, aches and pains in the muscles, difficulty swallowing, twitching or trembling, sweating, rapid heartbeat shaking, nausea, lightheadedness and tingling in the extremities, I'm out of breath, having to use the restroom frequently, hot flashes. How is generalized anxiety disorder diagnosed? A mental health professional or primary care physician can diagnose generalized anxiety disorder using the DSM-5 criteria or various questionnaires, such as the GAD-7. The doctor may inquire about the patient's symptoms, family history, and medical history, as well as perform a physical examination. It may take some time to differentiate generalized anxiety from other medical or mental health conditions like OCD, phobias, and depression. What's the difference between typical worry and generalized anxiety disorder? Everyone experiences anxiety on occasion. Anxiety can even be beneficial because it has the ability to focus attention or drive people to take action. Anxiety becomes a disorder, however, when worry becomes excessive and interferes with daily functioning. For example, if anxiety consistently prevents someone from concentrating and completing their work tasks, this could be a sign of an anxiety disorder. Causes. Anxiety disorders are complex and result from a combination of genetic, behavioral, developmental, and other factors. A familial history of anxiety, as well as recent or prolonged experiences of stress, are risk factors for GAD. The fear and anxiety brain circuitry is known to contribute to the experience of GAD, but the mechanism by which GAD is activated is unknown. Studies of twins and families suggest that genes play a role in the origin of anxiety disorders. Childhood adversity and parental overprotection have both been associated with the later development of GAD. Before making a diagnosis, it is critical to eliminate medical causes of anxiety, such as thyroid diseases. The most commonly prescribed therapies for this illness are medication and cognitive behavioral therapy, CBT. Antidepressants. A number of medications that were originally approved to treat depression are now effective in the treatment of anxiety disorders. These medications must be used for several weeks before symptoms begin to fade, so don't get frustrated and stop taking them. They require an opportunity to work. SSRIs. selective serotonin reuptake inhibitors, are antidepressants that act on a chemical messenger in the brain called serotonin and are frequently given for GAD. Venlafaxine, an SNRI, serotonin norepinephrine reuptake inhibitor, is also used as the first drug of choice. Although tricyclic antidepressants, an older class of antidepressants, are effective in treating the disorder, many physicians and patients prefer the newer drugs because tricyclics can cause dizziness, drowsiness, dry mouth, and weight gain. Imipramine, a medication used to treat panic disorder and GAD, is one example. Anti-anxiety medications. High-potency benzodiazepines relieve symptoms quickly and have few side effects, although drowsiness can be a problem. Because they can cause tolerance and require increasing the dosage to achieve the same effect, benzodiazepines are typically prescribed for short periods of time. People who have a history of drug or alcohol abuse are not usually suitable candidates for these drugs because they risk becoming addicted. When people stop using benzodiazepines abruptly rather than gradually, they may develop withdrawal symptoms, and anxiety may return. Potential problems with benzodiazepines have led some physicians to shy away from using them or to use them in inadequate doses, even when they are of potential benefit to the patient. Alprazolam is a benzodiazepine that can help with panic attacks and GAD. Clonazepam, Klonopin, is used to treat social anxiety and GAD. Buspirone, an anti-anxiety medication that belongs to the azipirone class of drugs, is used to treat GAD. Dizziness, headaches, and nausea are all possible side effects. Buspirone, unlike benzodiazepines, must be used continuously for at least 2 weeks to have an anti-anxiety effect. Other medicines. Beta blockers, such as propranolol, are widely used to treat cardiac issues but are also useful for certain anxiety disorders, including social phobia. When a feared situation, such as giving a scheduled oral presentation, can be predicted in advance, your doctor may prescribe a beta blocker to keep your heart from pounding, your hands from shaking, and other physical symptoms under control. Psychotherapy. Talking with a skilled mental health practitioner, such as a psychiatrist, psychologist, social worker, or counselor, to learn how to deal with problems like anxiety disorders is what psychotherapy entails. Cognitive behavioral therapy, CBT. CBT is particularly beneficial in treating anxiety disorders. The cognitive dimension assists people in changing their thought patterns that support their fears, while the behavioral dimension assists people in changing how they react to anxiety-provoking situations. CBT can be done in a group setting if the participants have sufficiently similar difficulties. Group therapy is especially beneficial for people who suffer from social anxiety. Often, homework is assigned for participants to complete between sessions. Medication combined with therapy is the best treatment option for many people. Subscribe to our channel News Today Reviews and feel better.